I get to see all I need to see. The linear probe is obviously higher frequency. On a larger individual, you're going to have difficulty penetrating down to that joint space, and the footprint is a bit smaller. And I know that a lot of systems offer what they call a virtual convex setting, and that can be helpful, but in general, you're really much better off in using the curved array probe. As far as a preset depth, typically I use a 9 centimeter scanning depth. The reason I mentioned that is because usually when the curved array probe is activated on an ultrasound system, the ultrasound system thinks you're looking for a baby, doing obstetric scanning, so the depth will default to something like 18 or 20 centimeters, and there's just no need to have all that depth. So here's an example of the difference. Linear probes, they have this trapezoidal or virtual convex setting, as I just mentioned to you. There is some limitation, as I said, to the acoustic footprint or the width of the probe. Patient habitus can alter that, and typically probe frequencies in linear probes don't go any lower than 7 megahertz. The curved array probe does produce a sector image as we see here. It's more routinely utilized. It has the larger acoustic footprint, and the frequency is much lower, 3.5 to 5 megahertz, which allows you to penetrate as deep as you want on basically any individual that you're trying to image. So let's talk about how to image the anterior hip capsule. Anatomically, we need to understand what that is on the anterior joint space, the labrum, the ligaments, and the capsule. The acetabular labrum is a fibrocartilage ring, just like the labrum in the shoulder, that makes that ball and socket joint deeper so we can have a more stable joint. That's what the labrum does. It's that fibrocartilage ring that makes the socket deeper. Now, relative to the ligaments and the capsular membrane, we have to keep in mind that the ligaments, the iliofemoral and the pubofemoral ligaments are highlighted in green and blue for you, are a contiguous or a combined interface with the capsular membrane. So the ligaments, the iliofemoral and the pubofemoral ligaments, are combined with, in the normal anatomy or even abnormal, with the capsular margin. That means you will not distinguish an interface between the capsular membrane and the interarticular ligaments. That's an important concept to remember. So how do we do this image? We're going to have the patient supine, obviously. We're going to place the probe obliquely along axis to be in line with the femoral neck. We're not going to use the femoral shaft as our bony landmark. We're going to use the femoral neck. So it's obliquely oriented curved array probe in line with the neck, not with the femoral shaft. It's also important, it's not shown in the photograph, but when I have the patient, when in the supine position, allow the foot to roll out into relaxed external rotation. And it's important that you glance down at their foot, because